Good morning, everyone. I'm Dion Shumbi, the CEO of Consumer Healthcare Products Australia. We are delighted that you could join us for the launch of this the research that we've conducted recently, and also to share some of the insights that have been revealed through this research. Before I go into the presentation, just a few comments on housekeeping. The first is this meeting will be recorded, and we will make the recording and the slides, as well as access to the full report, available to you tomorrow. So we will be in touch again. So the purpose of today is to launch a report, as I said, which we've on self-care, which we commissioned recently, and to share some of the insights that have been revealed by the research. To provide a bit of context, I'll give you a brief outline of the journey that led us to this point. At the heart of all of this is, of course, self-care and its key enabler. Now, there's this definition of self-care on the slide. I won't go through the detail, but you can have a look at that. Why self-care? Because it has significant health and economic benefits, both for individuals in terms of improved health outcomes, and also for the public health system, as it results in better use of health resources, and it leads to results in more cost-effective healthcare. Self-care is beyond the scope of any single organisation or even a government. Collaborations with other stakeholders in healthcare are vital. In 2013, we spearheaded the establishment of the Australian Self-Care Alliance with a number of stakeholders with a shared interest in self-care. The Alliance started off as an informal group of dialogue partners, but has recently been established and registered as a health promotion charity with a diverse health stakeholder membership. In 2020, the Alliance supported the development of a world-first self-care policy blueprint, which was developed by Professor Rosemary Calder and her team at Mitchell Institute in the University of Victoria. On the international front, there's a Global Self-Care Federation, of which CHP Australia is a member, is collaborating with WHO and member countries to work on a resolution on self-care, calling for self-care to be embedded in global healthcare systems. While there has been a lot of meaningful progress, a lot remains to be done. As an industry, we are keen to continue playing our part in advancing self-care and health literacy, and our focus is to build on the good work that has already been done previously. Over the years, we've invested in research to build the evidence base supporting self-care. In 2021, we partnered with the PSA to commission research with the key objectives to understand how to advance self-care in the pharmacy setting. There were two components to this research. Phase one involved consumers, and phase two, as you would expect, community pharmacists. So that research confirmed some of what we've already known. It also confirmed suspicions that we have, if I can call it that, but has also revealed a wealth of new insights. And building on that research, we decided to commission Cube to conduct this research. And this is the purpose of today. It's now my pleasure to hand over to Bonnie Leibel, who was the lead on the research. She's from Cube, who's incidentally also an associate member of CHP Australia. Thank you. Over to you, Bonnie.
Good morning, everyone. Thank you for the warm welcome, Dion, and also a big thank you to Brenda and the broader CHT team who've entrusted me with this piece of research in Cube. I'd first like to acknowledge that I'm on the land of both the Bidjigal and the Gadigal people of the Eora Nation, and I pay my respects to elders past, present and emerging from all the lands on which we meet today. I thought I would start by echoing Dion's comments on just how important the self-care is to our community. So as Dion mentioned, self-care is crucial to both individuals' health, but also the overall impact to Australia's healthcare system is rather staggering. So it's estimated that by 2025, nearly 30,000 Australians' lives could be saved through self-care practices, enhancing prevention action and halting chronic disease. So with this important figure in mind, we set out to better understand the level of Australia's knowledge, perceptions and behaviours, and to see where Australia is positioned when it comes to self-care. So together with Lonergan, a well-known and well-respected independent research agency, we surveyed a cross-section of 2,000 Australians over 18 years old throughout all states and territories last month. The 20-question online study was conducted by participants in both capital and non-capital cities. Within the survey, we pay particular attention to self-management, health literacy, digital health behaviours, and the interaction with healthcare professionals. The research uncovered a series of important insights and opportunities to support and foster greater levels of self-care in Australia. Overall, when it comes to health, Australians have a very high sense of responsibility, and they are more than willing, and indeed they want to, increase their health knowledge, understanding and skills. Australians understand the importance of good self-care, but the findings did also demonstrate that there are gaps in what information people have and how best to use it. So if we look at the respondents, we were able to get a really nice cross-section of the community, an even split on gender and a relatively even split across the age groups as well. We saw a very balanced split across all states and territories, in addition to capturing those both in capital cities and the regional areas. We did also provide respondents with the opportunity to select if they had any health conditions, which gave us some really interesting results, which we'll share later in this presentation, once we actually drilled down into that data set. So how engaged do Australians feel? Engagement is a key component of self-care. And over the past 2 years, I know for many of us, it has felt like we have upped our self-care practices significantly, fine-tuning our hand-washing rituals, wearing masks and social distancing. However, despite the pandemic happening all around us and this increased focus on preventing illness, Australians still report a relatively low level of engagement in health. Even with a significant proportion of those surveyed managing a current health condition, 1 in 2 Australians state they have a very relatively low to medium engagement in their health. So who feels most engaged with self-care? The findings show that Australians who consider themselves the most engaged are people who have enjoyed more laps around the sun. So baby boomers are the most engaged age group, with engagement levels of 66%, alongside those with long-term health conditions, who have a listing of 56%. Engagement in healthcare does dip through the ages, with Gen X at 51%, Millennials at 43%, and Gen Z trailing with 29%, which suggests those with the most experience managing health outcomes are those who are more engaged. The results also showed women are more likely to have higher engagement with their health, with 55% of women considering themselves to be highly engaged and 40% of men stating the same. So the link between being engaged and being informed. So the findings reinforce how an understanding and appreciation of health is linked to greater empowerment. People who reported having the highest health literacy were more likely to consider their engagement to be high. This indicates that it is likely that if we were to boost health literacy, it could lead to an overall increase in self-care engagement. So already we can see that there is a clear opportunity here to make a significant difference. And we all know health literacy is absolutely key. So health literacy includes the ability to find and understand information and services, and also the skills to interpret health information and appropriately apply it to individual circumstances. So it affects people's abilities to make decisions and take action on their own health. And Australians' health literacy levels are really mixed. So just 1 in 5 Australians rate their health literacy as high, while nearly 1 in 3 believe their health literacy is low. The report shows Australians have a strong appetite for self-care and that we are a responsible bunch. So nearly all Australians agree that they're responsible for managing their own health, with a significant proportion, 85%, also agreeing that they should do more to improve their health. However, more than a quarter of Australians, 27%, believe they don't have the information they need to sufficiently manage their health. And this is driven by the younger generations, with Gen Z and millennials feeling the lack of information, while baby boomers and Gen X feeling like they have the information and skills needed to manage those common health conditions. So how confident do Australians feel? Whether it's engaging in actions to prevent illness or knowing when to access and understand digital health services, confidence levels vary when it comes to matters of health skills and knowledge. So we know that Australians want to be better equipped to manage their own health, but there are many people who don't feel the confidence in their skills and knowledge to engage in actions and prevent illness. This presents a receptive and motivated audience for education, which is again an opportunity. This figure is largely driven by the younger age groups, with nearly 1 in 5 of Gen Z and 1/3 of millennials agreeing they have a lack of information, while 15% of baby boomers and 22% of Gen X are more likely to feel that they have enough information. So where do Australians go to feel more informed on matters of self-care or health information? Is it online or is it in person? Not surprisingly, to most of us, use of online and digital technologies for health is quite high. So whether it's searching for a website for information about a medical condition, reviewing a script online, making an online booking with doctors, or reading info on social media platforms and sharing content in patient health groups. Technology plays an increasing role in how we engage with our healthcare. In fact, one of the big takeaways is that digital health is increasingly becoming Australians' first point of call for information. So 4 in 5, 81%, report using health websites or apps to research or find information on their health condition. So with access to information in our hands and at our fingertips, it's not really surprising that 2/3 of Australians also head to health websites and apps before seeking professional advice from either a GP or a pharmacist. Millennials lead the digital charge, with 80% going online for health information before seeing a GP or pharmacist. Gen Z isn't too far behind at 75%, and Gen X is also savvy online, with 67% searching for information on a device ahead of going to a healthcare professional. Baby boomers, not so much. 1 in 2, 47%, are still likely to have sought out information before seeking help from a healthcare professional. Interestingly, almost 2 in 5 people read health information on social media, either through their feed, or if they found answers on the community sites, or sought counsel through patient support groups. So turning to Dr. Google first, with 2/3 of Aussies seeking counsel from Dr. Google before seeing a GP or pharmacist for common health conditions, we found it highly concerning that only 9% state they fully understand what they're reading. So it really seems that Australia has a digital health literacy dilemma. Despite the high numbers turning to online resources, many admit they struggle to A, first find the right information, with 52% having trouble identifying credible sources of information. B, when they do find the information, 37% find it difficult to navigate their way through. And C, even where online information is credible, not everyone can take it all in. So as mentioned, only 9% state they fully understand what they're reading. So this means 9 in 10 Australians do not fully comprehend this critical health information. An additional layer to that is that we're also assuming that they know how to identify their symptoms. While baby boomers are the least likely to head online first, they are the most likely to report comprehending what they're reading, with nearly 8 out of 10, so 78%, understanding more than half. Does this come with the experience of them knowing their own body and illnesses? Quite possibly. Younger generations absorb less information. Millennials report 65% understand more than half of what they're reading, and 57% for Gen Z. So 69% of Aussies are choosing to engage in their own health management using digital health services to seek advice for short-term health conditions. This can range from simply making an online health booking or renewing a script to telehealth consults. Online bookings and telehealth consults were the most popular, with 36% using online bookings and 32% for telehealth. This has no doubt been aided by the changes we're all experiencing during COVID and the fact that people are less likely to go out in public, go into a doctor's room if they don't have to. In fact, it's estimated that telehealth usage has increased 38 times since the pre-COVID baseline. So driving self-care with online services. Other digital services being used include instant scripts, electronic health records, wearable medical devices, and more. So with 19% wearing smartwatches, that could be an Apple Watch, a Fitbit, or 22% engaging with their electronic health records. With 2/3 choosing to use these digital health services to engage in their health management, it is of little surprise to learn that younger generations are leading this charge. So with Gen Z, 76%, and 8 out of 10 millennials, so 80%. However, Gen X and baby boomers are also still a strong part of the mix, with 70% of Gen X engaging in digital services and 54% of baby boomers. That said, there are still people not using digital services or social platforms for health information and wouldn't know how. So 1 in 3, 31% of Australians indicated that they do not engage with any digital health services at all. So what are the barriers to digital health uptake? The barriers or challenges Aussies are facing when it comes to digital health technologies are the volumes of health information online. It's a confusing landscape for many, with a lack of consistency of how information is presented, finding conflicting information, confusion of who the information is for, and uncertainty about the quality of the source. The findings also suggest that Aussies are, for the most part, healthy skeptics when it comes to online information, and they do apply caution before accepting what they discover at face value. 1 in 6 Australians, 17%, choose not to access digital health services and technology at all because they don't know how to identify the credible ones, with 16% saying they don't trust them. Overall, half, so 52%, agree they have difficulty identifying the credible sources of digital health information. 1 in 8 reported not accessing digital services and technology when they have a health condition because there is too much content or they found it difficult to read or understand. So this presents a significant opportunity for us all to engage Australians. Nearly 1/3 would trust online health information more if it was independently verified. So what would increase trust? Australians want to be sure they can believe the information they see, and the survey shows that 44% would trust information more if it was provided by the government. Other ways trust could be built is if the site was recommended by a healthcare professional or if it was written by a trusted science or medical communicator or independently verified. So GPs and pharmacists play a trusted role. While many turn to online sources, in-person interaction is still key for many when it comes to self-care. Engaging with professional providers like GPs and pharmacists are still a big part of how we manage our health. While pharmacists are viewed as professional and trusted experts, they are not always a first point of call for common health conditions. Despite 82% of Australians agreeing that they'd seek pharmacist advice for a common short-term health condition, the findings show 50% will head online and 76% will organise a GP consult ahead of seeking a pharmacist's advice. Nearly 3/4 of Australians rely on pharmacists for advice, notably on using prescription medicines, and 3 in 5 seek guidance on non-prescription medicines. However, pharmacists still command a great deal of trust, and many Australians consider them to be the top source of advice. In fact, 2/3 of Australians value pharmacists as professional, and 59% view them as healthcare experts who can be trusted. This is backed up by more than 80% of Australians agreeing they'd be at least somewhat likely to seek a pharmacist's advice for a common short-term health condition. So a bit of a deep dive into the generations and their behaviours with healthcare professionals. Baby boomers and Gen X are more likely to seek advice from a healthcare professional, including a pharmacist or GP for common health conditions. Millennials and Gen Z, who are less engaged with self-care, have fewer reasons to use a pharmacy and develop relationships with healthcare professionals. As we saw earlier, not surprisingly, they are more likely to get their health information from digital sources, including social media. Interestingly, baby boomers, despite strongly reinforcing the trust and capability of pharmacists, are least likely to seek advice from a pharmacist for a short-term health condition, with 79% versus Gen X and millennials sitting at 84%. So what are the reasons for seeking a pharmacist's advice? 1 in 2 seek out a pharmacist's advice, believing it's not serious, but they do just want that peace of mind and to have that trusted counsel. With GP waiting rooms and waiting times exploding, many seek out a pharmacist's advice as it's viewed as the faster access versus a GP, sitting at 43. 37% also report trusting pharmacists to be more qualified to provide the right advice. So on the flip side, what are the barriers to seeking a pharmacist's advice? 20% of Australians not knowing what a pharmacist can help with can be a barrier for them. Other aspects that can give people pause in approaching a pharmacist is that the pharmacist appears too busy, and 15% feel the question may be a waste of time for the pharmacist. 19% of people also feel embarrassed surrounding the nature of their condition. And this is especially true for women who reported they also felt concern for the lack of privacy in the pharmacy setting. 1/4, sitting at 26%, also reinforced their relationship with their GP is the reason for not seeking pharmacist advice. So Australians want to improve children's health literacy. Most Australians want children to learn about owning their own healthcare. When asked to think about health literacy and engagement in children, to what extent did people agree that more should be done by parents to increase their child's health literacy? About 92% agreed more should be done, and 88% agreed that schools should be doing more. However, when we dug deeper on whose role it is to teach health literacy to children, opinions varied and showed that this is a role we can all take a part in. Overwhelming, the findings confirm a strong desire for younger generations to be well informed and equipped when it comes to their health. Supporting the importance of children gaining health literacy skills early reinforces how much the community understands society will be better off with younger generations becoming more knowledgeable and well equipped when it comes to health. It also suggests that younger adults who are less engaged with self-care also do understand its importance. So the desire to improve. Australians genuinely do want to know more about healthcare and improve their health literacy, skills, and knowledge. So importantly, 78% can identify a specific area of self-care that they would like to improve. This charge is led by younger generations, suggesting older generations are slightly more satisfied with the level of knowledge that they've acquired in their lives. So what specifically would Australians like to improve? The areas that the 78% of Australians have identified include 34% wanting to identify credible sources of health information, which is a key theme throughout the report. 33% also desire a greater understanding of how to prevent illness and support their general health and well-being. So echoing other questions and outcomes in the survey, we found that being able to identify these credible sources of health information without a doubt tops the list. But this was closely followed by people saying that they wanted to develop that greater understanding to navigate the healthcare system more effectively and prevent illness. So where to next for Australian healthcare and self-care? We know our healthcare systems are currently under significant strain due to the pandemic. We also know Australians empowered and supported to take greater ownership of their journey through self-care, achieve better health outcomes, prevent illness, and have lower health costs. Although the findings show a relatively low engagement in health across the population, in positive, there is a very strong sense of responsibility to do more with our health. This sets a very firm foundation for education and an activation of pathways to build improved self-care behaviours. Health literacy is very central to this and depends on an individual not just understanding information, but how that applies specifically to their journey in maintaining their health. With so many Aussies heading online, the opportunity to enhance education, engagement, and monitoring is huge. So online resources and digital technologies will increase in use. They will not stop. But with 9 in 10 Australians saying that they don't fully understand the information they uncover online, and half of Australians saying that they find it difficult to identify the credible sources of digital health information, this is an obvious and urgent need to help Aussies navigate online health resources. There is also the opportunity to reinforce the critical role of pharmacists beyond prescription medicines, letting Australians know that pharmacists can help them better understand information and how it specifically applies to them as individuals. The opportunities really are vast and plentiful. Every one of these stats in the report and mentioned today is an opportunity for all of us, no matter where we work or what we do. This could look like a national or state level change. So the development of the National Digital Health Literacy Program, finding a way to verify a reliable source of truth for health information in Australia. Perhaps that's raising awareness of a site that's already in existence. It could be a change in your local school or community. So creating further education programs in primary and high schools on self-care practices or how to understand health information from a younger age. It could be a change at home. So in our roles as parents or caregivers, teaching our children or those we're looking after to better their self-care practices. It could be a change in your business, such as creating more private spaces in a pharmacy for people to feel safe and comfortable to seek counsel. We really hope that this session has helped you consider to be inspired on what role you or your organisation can play in the great self-care opportunity that is ahead of us. And that we can all play a role together in guiding future self-care policies, strategies and initiatives that contribute to the health of all Australians. Thank you.
Thanks very much for that, Bonnie. Fascinating, absolutely fascinating, and clearly a lot of work to be done. Now, we've received several questions. We'll go through them one by one. First one was a question around the sample size of each generation is relatively small, so 30% would be roughly 600 of the 2,000. How robust can we feel about these results? What are your thoughts, Bonnie?
Yeah, so I think, it is a very solid sample size of 2,000 with those even splits. So, often a lot of these surveys, are only at the 1,000 mark. So I think this is a substantial split. So I think it's absolutely a very solid reference point.
Thank you. Another question around 69% of people using digital health services as a result of the pandemic and restrictions and staying at home. Do we anticipate that figure will come down when things return to fairly normal again?
From my personal opinion, no, I don't think it will ever go down. I think it's forced us to see the new opportunities and, the efficiency of online. I think it's probably very similar to how, working practices have changed. I doubt that working, full-time in an office will ever become the norm again. I think flexible working is the new norm, very similarly to digital health.
Thanks. And an observation from Christine, say Google decides the websites that are credible for health conditions. These sources are all government health websites. If 16% of people don't trust these websites, then the issue involves building trust, and verification is one solution. I think we wholeheartedly agree with that observation. What do you think?
Sorry, Dion, can you say that one again?
It's the websites. People, that 16% of people don't trust websites. What can be done about that?
Yeah, I mean, I think it does really come back to, those few key points in terms of what will create more trust. Obviously, we have the verification, we have the recommendations from healthcare professionals. So I think there's some really tangible examples within the data showing what will support that trust. But again, it's going to come from word of mouth from healthcare professionals, whether there is a verification tool. Those sort of key examples.
Right. Here's a question about what is government doing around self-care and health literacy. Perhaps I can answer that question. I mentioned earlier that the self-care policy blueprint, which was developed by Professor Rosemary Calder and her team at Mitchell Institute, one of the recommendations in that report is a national health literacy strategy aimed at improving health literacy and enable greater self-care. So following that report, there was the previous government launched the National Preventative Health Strategy, and in that report, health literacy was identified as an immediate priority. And the work commenced under the previous government, as I said, on a national health literacy strategy. And we're convinced it is as a direct result of the work done by Professor Calder. So it's a long journey, but there's some significant wins and encouraging developments underway. Let me just check with these other questions. Okay. Another one, how does Australia stack up compared to other countries? Interesting one. Yes, I believe we're doing extremely well. Back to the policy blueprint, I think that was a world first, and it drew much international attention. The Global Self-Care Federation, based in Geneva, developed a self-care readiness index in collaboration with WHO. And it's a research instrument to measure the level of self-care and health literacy in various international jurisdictions. The first report was launched last year, 10 countries included, and Australia is included in the second round of 10 countries. So we expect the publication of those results later this year. But I think we're doing pretty good so far. Questions around what is the biggest obstacle in advancing self-care? I think it's such a complex area. It's huge. The scope is enormous, and it will involve many stakeholders. Now, we've been talking about self-care for a very, very long time. And in the early days, there was quite a bit of skepticism around this area. And people felt that it meant no care. Don't go to the doctor. Don't go to the healthcare system. Look after yourself. Nothing could be further from the truth. And I mean, one of the definitions of WHO include it's the things that consumers, individuals, citizens do either by themselves or with the assistance or in collaboration with a healthcare professional. So it doesn't mean you're on your own. So there are many stakeholders in this space, and working with them or collaboration is challenging. There is a development in this area, this Australian Self-Care Alliance. Its membership is broadening, and there is all members are aligned on the issue of advancing self-care and health literacy. Okay. There's a question or an observation from John Litt, is incidentally also a director on the Self-Care Alliance. There are many websites out there, and we recently did separate work. We're looking at exactly what sort of sites are available. And what the research revealed is there are a plethora of very, very good information out there. For example, Health Direct is one of those. The question, however, is to what degree consumers use those websites. And the research that Bonnie talked about now, the findings that people look at the right information, but don't feel that they fully understand or comprehend the information that they're looking at. So it's not only about providing reliable resources and sources of information, it's also presenting it in a format that is understandable and actionable. And none of these websites, as far as we could gather, are being promoted. So there's perhaps some work to be done there, is to harness all the good sources of information that's already out there and assist consumers to go visit those sites. Further questions? One from Rob Barnes. Are those health literacy initiatives progressed under the previous government likely to continue under the new government? Yes, the answer to that is absolutely yes. The work is underway. Just another question about a copy of the deck. This will be available, the full report, the recording of the session, as well as the slide deck will be available tomorrow. So we will be in touch. Question here from Patricia Greenway. What plans are being considered for the collaboration with patient organisations, really their important role in health literacy and the importance of advising, supporting verified sites? So this is also the work identified in the policy blueprint, and this is also work that the Self-Care Alliance will be undertaking. Consumers are well represented on that group, but we need to include more consumer and organisations to assist in this work. Let's not forget that this is about consumers, about citizens, about individuals, and the systems and support needs to be designed to meet their needs and expectations. I think those are the questions, maybe. Okay, do these results that published today confirm the previous work that we've done jointly with the PSA, the research that I mentioned in pharmacy on consumers, focusing on consumers and their health information needs, as well as pharmacists' role in self-care? Yes, these results confirm that, and as I said earlier, also the new insights revealed in this research. So there's a lot of analyses still need to be done to fully understand what this all tells us, but very important work and certainly pointing in the right direction. I think that's the last question. We may wrap up early. If there are no further questions, let me just check. No. That's all. So thanks again, everyone, for joining us. We hope you found this interesting, and look out for the recording and the slide deck, as well as the full report to be published tomorrow. So thanks again.